Truthfully, the worst part was being clipped into that mask every day. And I had to do a ton of work in therapy, honestly, to be able to simply show up to these appointments without being medicated. Hi, my name is Alyssa Nilsson. I am almost 32 years old. We live in Utah, just about an hour south of Salt Lake City. I am married to, we like to call ourselves elementary school sweetheart. So I have grown up with my husband. I've known him for most of my life. We have three kids. We have two boys and a little girl, and we love being outdoors. We love spending time together. We are members of the Church of Jesus Christ of Latter-day Saints, and that has been a huge part of our journey and story through everything that we've gone through. It's a huge anchor and faith to what we've gone through. So I was officially diagnosed just this last September with adenoid cystic carcinoma. It was found in my parotid gland. When I was pregnant with my third child, I started to have really slight jaw pain. But it tends to be that when you're pregnant, they just say everything is due to pregnancy. So, you have a backache, like, oh, you're pregnant. You have an earache, like, oh, you're pregnant. And so I had my midwife like check my ear at one point because I thought maybe my jaw hurts because I have an ear infection. And so she checked my ear and it was totally fine. And that was really all at the time. Like, it really didn't bother me very much. It was just a few little things while I was pregnant, and it kind of just got chalked up to, I don't know, you're pregnant. Everything, can be towards that. So, I had my daughter, and that was a whirlwind of an experience. I ended up getting really, really, really sick after I had her, and I almost died from an infection after giving birth. My delivery with her was beautiful, but the infection afterwards, I had to be life flighted, and I spent time in the ICU, and I had a massive surgery, and I was in the hospital for a long time. And so, obviously, during that, I was on a lot of medications, so my jaw and my ear never bothered me. But after that, it kind of started to bother me again. And again, the doctors were like, well, I wasn't pregnant at the time anymore, but it was all blamed on what had just happened to me because I had been so ill. And so they're like, oh, well, you just were so sick. And so now you're really stressed. And so your jaw hurts because you're clenching because you're so stressed because of everything that you went through. And the thing with what happened to me after my daughter was born is the doctors also weren't really sure what was happening to me when I started to get sick after giving birth. They just kept telling me, this is just regular after birth things. And I really learned how to be in tune with my body at that time, and I knew that something was not right in regard to that. And so afterwards, when the jaw pain really kept persisting and I just kept being told, like, oh, it's stress, oh, you have TMJ problem, I realized, like, I know my body. I have been through enough. And so I know what my body feels like. This is not typical. Also, to add, I am a dental hygienist. And so I actually work with patients who have TMJ disorder all the time. And it didn't feel like that's exactly what it was. After visiting with my dentist, he sent me to an ENT. And it was kind of after the ENT who truthfully didn't really listen to what I had to say. He just wanted to give me a TMJ diagnosis, and it just felt like no matter what I said, that's all he was hearing in his head. And so after that, I got bounced around. I got sent to like physical therapy. I got sent to chiropractor. I even went to an orthodontist to see if like maybe they could adjust my bite. And so that would help like the TMJ soreness. But at each step that I took, nothing was helping at all. I did physical therapy. I did a ton of exercises there. Like nothing was helping and actually just kept getting worse. And so it got to the point where every time I would start to eat a meal, I would have this just lightning pain across my face right here. And it would just be the first bite of food I would take, and I could eat my meal and I would be fine. And so I started realizing that pattern, like, okay, when I start to eat, it really is so painful. And so I went back to the ENT, and all he heard, no matter words, no matter what was coming out of my mouth, all that he heard was TMJ pain, TMJ pain. So he did end up ordering another imaging, and the imaging came back completely normal. And he was like, there's nothing wrong with your TMJ. I'm like, well, what about everything else? He's like, well, you just need to go back and do, PT or whatever. I would hide in my kitchen before I would start to eat a meal so that my kids wouldn't see how much pain I was in. And so I would hide, I would have like my first bite of food prepped, like ready to take a bite, and I would take it and I would just have to brace myself and let this pain just stab me across, and then I could go and eat my meal. So I realized at that point, this has to be something with my salivation. And so, with all of my own research and just putting things together, I went to another ENT and I basically told him, this is what I think I have. I know it's rare, but this is what I think it is. And you need to order the imaging for it. And so he luckily ordered the appropriate imaging, because come to find out, the imaging that was done months and months prior, it was imaging just to look at my joint here and nothing else. And so that's why it was missed on that one. And within 24 hours, he calls me back and he was like, there's a tumor there. I show up to this new ENT, and he ultimately decided, like, first time seeing him, he wanted to do a biopsy. And I kind of challenged that idea a little bit. I was like, can we just like get this out? I'm in so much pain. Also, to note, because of everything I had experienced after my daughter was born, and my time in the ICU, and I had a lot of rehospitalizations, my medical anxiety is extremely high. The ICU was a really, really, really dark place for me, and it really, with everything that happened there, it affected me emotionally and mentally significantly. And so if I could avoid any more needle pokes or anything, that would have been ideal. But he obviously needed to do a biopsy because they need to know when they go in for surgery how aggressive they need to be removing a tumor. So he essentially numbs me up all around here with just some local anesthetic, and starts to put a needle through my face right here. And I felt everything. Um, I ended up being just in full blown panic attack, sobbing. I'm like asking to hold the nurse's hand because it's so painful, but he's just trying to get it done and over with. It was inconclusive. So they couldn't say it wasn't cancer. They had to move forward with scheduling a surgery. And so I got scheduled for a surgery, and they took the whole tumor, sent it in for pathology, and then that's when the official diagnosis came in. I went in for surgery, and again, the medical anxiety factor in all of this was very much present. I've had several operations in the last just 2 years due to the complications of my delivery. And I've been a very healthy person my whole life. And so having this all concentrated in an 18-month period of time was just overload for my brain. So I showed up for surgery. I was extremely stressed because the tumor was in my salivary gland right here, and they were pretty sure that it was wrapped around my facial nerve. And your facial nerve controls a lot of things in your face here. So it controls like your smile, movement of your nose, your eyebrows, your eyes. And so there was a really big chance that I was going to lose function of this side of my face. And I was certain that I was going to wake up and never be able to smile on this side again. And unfortunately, like I just met a girl in the hospital recently who had a similar surgery, and it happened to her. And so it's a very real possibility. And so I remember just taking a bunch of pictures with my husband. I'm like, let's take one more selfie because I just want one more smile that I can get. And obviously you can see that didn't happen. And so, my surgeon came in, and even IVs are really hard for me because my arms were scarred in the ICU. So the surgery ended up being over 4 hours. It was wrapped around my nerve. He took a lot of time to take good care of the nerve. He actually had to take out part of my muscle in my neck right here because when he removed the tumor, there was a part of my cheek that was indented just from removing like pieces of my face. And so he took a piece of my muscle here and actually put it in to my face to kind of like pad and try and make it look like the other side. The tumor was around 3 centimeters big. We did end up deciding to move forward with radiation at Huntsman after speaking with the doctor. So I saw two doctors up at Huntsman in Salt Lake, and they both said the same thing to me. They both said, with this type of cancer, we almost always do radiation following surgery. No matter how successful the surgery was, we pretty much always do radiation. And it matched up with what my husband and I were feeling. Like that's kind of what we had already felt. And so when they said that, it matched up with, everything before. So I ultimately decided to move forward with radiation there. They opted to do 20 treatments. I had to have a head and neck radiation mask made. If you've ever seen what those look like, if you haven't, should look it up because they're really intense. So I had to have a mask be made and I had to drive up to Salt Lake every day for those 20 treatments. Truthfully, the worst part was being clipped into that mask every day. And I had to do a ton of work in therapy, honestly, to be able to simply show up to these appointments without being medicated because it wasn't an option for us. I have talked to other people on social media who actually have been medicated just to be able to get into that mask every day. But it wasn't an option for us because of our childcare situation. My husband was still working at the time. We have 3 young kids, and it was simply not an option for me to need to be driven to every single appointment. So I had to do a ton of work in therapy to be able to show up and not have a panic attack on that table every single day. So I would show up, I would go back. Luckily for me, one thing of comfort that I was able to keep was to just keep my regular street clothes on because it was in this area. I was able to choose what I wore. So it was one nice kind of sense of control. And then the other thing is they let me choose a music playlist. So they would play a Spotify playlist in the room and I got to listen to that. The symptoms really didn't start till maybe like a week or two in, and I started to get just some more, again, TMJ problems, and I just had a little bit of swelling around here. My mouth started getting really dry. It still is a problem right now, so that's still something I'm dealing with, but my mouth started getting really dry. My mouth was sore. I've had like a constant sore throat. It started bugging my ear just because everything was a little bit swollen. And so I think just the swelling was bugging my ear. Obviously, the skin irritation. I'm trying to think what else there. Well, oh, my taste changed. So my taste started to change, and that was terrible. Like, there were some foods I could not tolerate even a little bit. Like, it tasted like rotten metal gross. It was so, so gross. So that was really tough to be able to try to keep like eating and get the calories in just because it hurt. It was not comfortable. Nothing tasted normal. And it ended up being, so I finished, so let me go back. So I finished 20 rounds. And the thing with radiation is that it compounds. Symptoms compound. So like the first day, it's not too bad, but then the second day, it's not just like your second day of radiation. It's like 1 and 2 that are now. And so once you get to 20, it's like 20 rounds that are all just compounding on each other. And so the side effects don't end on your last day. So I finished and it actually got worse for probably like a week and a half. So that's actually when the burns showed up on my face. I had behind my ear and inside my ear, I had like some blisters. My scar was bright red and the taste changes just kept happening and I was so, so tired. So it wasn't probably till about 10 days after that I felt like my symptoms stopped worsening. My last day of treatment, we ended up bringing my whole family up there. And I had made it up to this point. I had done 19 rounds and I had managed to not cry on the table one time. I think I cried every car ride there and home, but I had made it through all 19 laying on that table, just trying to be as composed as I could. But as they clipped the mask on and they left the room, and I knew that it was my last time, I just, tears were flowing, but I can't move in that thing. So I'm just in the mask, just trying not to sob and just knowing my kids are out there waiting for me. And they unclipped me. I got to take my mask home and I walked around the corner, and my husband and all my kids were there waiting for me. And so we were able to hug and cry, and then we left. And well, we also got to go, they gave us a gift card, and so we got to go upstairs and all my kids got to choose a bag of chips from the hospital, and that was like a highlight of their day. I ended up finding a new surgeon up at Huntsman, so this one takes his time a lot more. So I alternate between the two of them every 3 months. And typically, like he just mentioned to me this morning, he said a lot of times with most cancers, if you can make it 5 years without any recurrences or anything, then you're usually like cancer free and you just like move on with your life. But unfortunately, this one is known to come back at any time. And so he said even 5, 10, 15 years, you could go and like have like the no evidence of disease and then it will just pop back up. And so this is essentially a lifelong thing for me at this point, that pretty much for the rest of forever, unless science changes, I will have a scan about once a year and continue with the checkups probably at least like once a year, every 6 months or so. And that's just moving forward for the time being. So I do a scan every so often. They do it in the same area because it most often comes back to the same spot. But then I also have a scan of my lungs because the first place it goes is right to your lungs. So they'll be checking on both of those spots. Getting through all of this mentally has been the hardest part. Like, I feel like I know what I went through after my daughter was born. I After all of that happened, I literally couldn't walk. Like, I was so sick. I couldn't walk. I had lost most of my muscle strength, and I was able to take a while and heal from that. And right before my operation here, I was trail running up in the mountains like 7 miles. And so the physical challenge was obviously there, but it was the mental part that was just astronomical compared to everything else. So, like I mentioned, I've spent a decent amount of time in therapy. My therapist has been wonderful. She helped me with various visualizations to take with me to radiation, mostly because I had my biggest fear, I guess you could say, was that sense of being really alone on that radiation table because nobody else is in there with you. And so just that, like the deep sadness and fear of being really alone was really hard and terrifying. And so she was able to help me with some really beautiful visualizations, a hard word, of myself and thinking of times when I like was strong or I felt taken care of, or I felt compassionate or just excited, or a time that I was filled with faith and things like that. And so that was able to really just help me stay grounded and think about like, I'm not just a person with cancer. Like I am a very, I am a person who has like a lot of parts to me, and I have been through a lot and I've made it through a lot. Talking about all the cancer and everything is actually easier than talking about my hysterectomy. It's often something that's very brushed aside because I had a hysterectomy to save my life. And so oftentimes people tend to just be like, oh, well, at least you're alive, or at least you have 3 kids, or at least XYZ, and it very quickly can negate the feelings because, yes, we did want to have more kids. And so it immediately, like, I lost my fertility. And it's been so crazy because it's so hard to talk about it because it feels hard for people to understand and to truly understand like the emotional toll and the emotional burden it's had on me and my family. Because yes, I am alive and I have 3 wonderful kids, and for all of those things, I'm so incredibly grateful. And but it is still so, so heavy and hard. And unfortunately, I know that when various people go through different cancer treatments as well, that they're often faced with losing their fertility. And so that's been heavy on my mind a lot to have those things happen simultaneously. I genuinely cannot even imagine what those women have to go through to have that done, because I had a full 18 months to try to digest and like process and like be just like, okay or not okay, and sitting with this fact that I lost my ability to have more children. But thinking of these women that find out they have cancer and possibly lose their fertility at the same time, I truly can't imagine what they have to go through for that. You know yourself the best, to trust your instincts, to trust your gut, to really just lean in and listen. I feel like part of the tricky part of cancer and illnesses and so many things is there's so much anxiety linked to it. And so it can be this constant like anxious thought, like you should get this checked out, or you have cancer, or whatever. Your 2 a.m. Google searches are always leading you to cancer. But if you just really try to quiet everything down, and I think that's what I've really tried to learn through all of this, is just like it's okay to slow down. Like it is okay to slow down your life, to take a breath, to take a moment to meditate, to prayer, to just have a quiet time in your schedule, and then like listen to your instincts, because that was a hard part, where knowing like, is this anxiety just like worrying me, or is this something that's actually wrong that I need to get checked into? And so learning that like it's okay to just slow down and really listen to yourself. And another thing it too is we really, like I mentioned, like we really cling to our faith. And a lot of people looking from the outside of us are like, wow, how can you just, keep believing in God even though you almost died and all these things happened? And it has not been that simple. I think even watching people, like, you always think that you know exactly what's going on, but we have been tested and tried so many ways, but we are just hanging on for dear life because that is what we want in our lives right now. And so we're just clinging to that. So we hope that even just our whole family, not even me, can just show that, it's possible to be resilient.